Hi, everyone. Well, there are a lot of people whose medical procedures did have to be postponed as area hospitals are preparing to treat patients with COVID-19. So here to discuss what's being done for those who were gearing up for weight loss surgeries is Dr. Darren Tishler. He is the director of metabolic and bariatric surgery at Hartford HealthCare. Doctor, thank you for being with us.
Thank you for having me, Kara.
Of course, everyone, I'm sure, is being understanding given these unprecedented circumstances, but this is almost an emotional thing as patients gear up for that actual surgery. So who are your patients and what stage of the process were they in?
Well, we have patients in a variety of stages of workup for surgery. And we have to remember, even though we have the COVID-19 crisis right now, patients still had other health problems prior to this and will still have them through this crisis and again after. So even though we have all these efforts going on now to take care of COVID-19, we still have to take care of our patients with existing health problems.
So what are you doing to stay engaged with your patients during this crisis?
Well, recently we did something really unprecedented. In a very short period of time, we launched a telehealth platform across our specialty services at Hartford HealthCare. And through that, we're able to have face-to-face visits with our patients without having that close physical contact. It's not perfect. I love being in front of my patients, but at the same time, we understand right now that's not the safest thing to do. So we're trying to provide the same level of care that we normally do, but via telehealth.
And how is that going? I know my mom had her first telehealth appointment. She was a little nervous. She couldn't figure it out. And then I think she got through it. But for those who might be thinking, oh, I don't know how to do this, what would you say?
Well, everyone has a little time right now. And so we have the ability to figure this out and really help guide people through this process. It's been going incredibly well. We've had patients young, old, every age in between, even people who speak different languages or maybe requiring sign language, and we've been able to utilize the telehealth platform for a wide variety of people. It takes a little time to set up, not very long. Some people it takes 2 minutes, some may take a little longer, but we have a dedicated team in our office that can really help people get set up and ready to go for a telehealth visit. And once it's been set up once, you're ready to go for life.
It can be really easy after that. Okay, so just to anyone listening who has concerns, your staff is there. They shouldn't feel bad. They can call. It's almost like a tech team. They'll walk them through it to get them set up.
Absolutely. And in a worst case scenario, we can always do a phone visit.
Okay. Do you have any tips for eating healthy and exercising? I know for some of your patients that might be a challenge in normal circumstances. I think it's a challenge for everyone right now, especially following social distancing rules.
Absolutely. I think a couple things come to mind. First and foremost, we're at home. It's very easy to snack all day, and I think it's very important that we set meal times to eat. Don't snack in between, have meal times. Make those meals enjoyable. Think about the meal ahead of time, plan ahead so we're not wasting food, and maybe use a variety of social media platforms, smartphones, just to be connected with our friends and family and have meals with them remotely. I think eating healthy still matters quite a bit. We want to minimize those trips to the grocery store as much as possible, so careful planning ahead of time can make a big difference. And as far as exercise is concerned, I think we have to work harder than ever before to get good quality exercise in. Now, if you can get outside while maintaining social distancing, that's great. Maybe around your house, wherever you live, there's a place where you can walk, get out and do routine exercising. I've also found that a variety of some of the more high-end platforms that are out there for exercise. So there's apps for your phone where you can do a class. My daughters were doing a dance class with Peloton yesterday, a cardio dance class. So there's so many things out there, and many of the companies that normally charge for their platforms are making these platforms free right now for the next 30 or 90 days. So it's a great opportunity to get some good exercise in using all of our technology.
So actually, one person is commenting on our feed right now who actually says, Samantha Mabe, I love this telehealth technology. I've been waiting for a couple of years for this to become a thing. I think a lot of people, for the appointments where it's appropriate, are probably happy they don't have to drive somewhere and would like this to keep going after.
Well, we've been preparing for telehealth for quite some time. Unfortunately, telehealth visits until just recently with the COVID crisis for many insurance companies were not authorized. We hope to break down those barriers. I think telehealth is here now, and it's going to be here to stay in the long run. long after COVID is resolved, we're going to be working hard to make sure this telehealth platform does stay there. Because, I mean, nothing's going to replace when I have to examine a patient. I can't do surgery through telehealth. But for many visits where someone needs a quick check or just a reassurance, I think these are things that are ideally suited for telehealth.
Absolutely. Yeah. And people are still obviously going to need the in-person diagnostics that you have for certain things. But what about your groups? Because I think you're just talking about weight loss, not snacking. We need accountability. So you've sort of created that, and that you have these new Facebook groups. You don't even have to be one of your patients to join, and it can help people stay accountable.
We recently launched a virtual support group. It's been something in the works, and again, we accelerated. Nothing is perfect quite yet, but we had our first virtual support group last night. It went very well. We're going to start getting more and more content out there on a daily basis. I'm going to try to go live on our Facebook page, at least a few times per week coming up to really help people get through this. I think everybody is struggling with diet and exercise and sitting at home, and anything that we can do to break up these long days sometimes I think is going to make a big difference.
Yeah, I've heard routines are important. I've been trying to do it. I like that. I just want to shout out to our viewers that you mentioned Peloton. I know Beachbody.com is also offering free trials for people where they have multiple trainers. A lot of the famous trainers that the celebrities are going to are giving free classes on Instagram. So if you're not very motivated on your own, some Google searching might help you align with a trainer that you wouldn't normally have.
There's a lot of content out there right now, and I think, again, it's helping to build in that personal connection that we may feel like we're losing right now being at home for so long.
Well, we appreciate you being here. I do have one question from the feed. I know it's a crystal ball question, but they're asking, when will you be able to do elective surgeries again?
Boy, I wish I knew the answer to that question. I hope real soon. Obviously, right now, we're preparing for anything that could happen with the COVID virus and illnesses, and we need to free up resources. And surgery is going to be one of those things where emergency surgery we will always do. We'll take care of it. Elective surgery is going to be phased in over time. I wish I had a crystal ball. I'm very hopeful that, though, this is going to be something in the next couple of months we'll be able to get back to life more as usual.
As long as I have you, doctor, you are there, and many of your colleagues are on the front lines of COVID-19, and we're hearing in the news that we are preparing for a surge of patients. It has not yet peaked in Connecticut. What are things looking like at the hospital?
Well, right now, hospital, it's about being prepared, exactly as you said, making sure we have beds available. We stopped doing elective procedures over a week ago, and by doing that, we've freed up a lot of resources in our hospital. I really hope and pray that this is something where we freed up a lot of resources and we don't need them, but if we do need them, we're going to be ready to go. And I have a lot of, I got a big shout out to everyone here, from the frontline staff to our leadership at Hartford HealthCare, who have been spending countless hours, if not 24 hours a day, really making sure we're prepared for this.
Thank you, Dr. Tishler, and I encourage everyone on the feed, if this is information that has inspired you, share it with your friends. We do appreciate the doctors coming on every day and speaking virtually. It's sort of our telemedia to help get the information out to as many people as possible about what the latest is at the hospital.